Welcome back to
Hello.
Scissors and Scrubs. And you know what we have today? Brand new equipment.
Ooh.
All brand new equipment.
I didn't even know where you were going with that, but we do have brand new equipment.
I did just come back from a drag lunch with Laura.
Yeah.
And some other girlfriends. They took me out for my 50th. Mm-hmm. And it ended with me vomiting in the gutter, which is always a good time.
But that shows that you had a fun day.
I had too much to eat. It really was because I had too much to eat.
Sure.
So because, we're talking about vomiting in the gutter, always a good time. We are going to cover bizarre medical treatments today, which literally writing some of this, I was gagging.
Wait till I get to my eye one.
Mine's milk baths. Milk baths are going to get you.
Oh, I don't like that.
And that's an honorable mention. It's
Okay.
fucking gross.
All right.
And I think, I could be wrong, do we have an email that we forgot to read at some point? Maybe we'll read it on the next episode.
Yeah.
We have an email. Somebody wrote us an email that we didn't read, I don't think.
Oh, okay.
And we want to just say hello to everybody and send us your emails. You've all been very quiet and I don't like it. Mm-hmm. Okay, so we're going to talk about bizarre medical treatments.
Okay.
Laura, do you want to go first?
Sure.
All right. Take it
I'm
away.
starting with one that my mother has to have and I will have to have, which is bloodletting.
Oh, I love a good bloodletting. Are they bringing out the leeches?
No, just bloodletting. So the art of bleeding the body for medical purposes is one of the oldest treatments in the world. It started over 2,000 years ago in Asia, Africa, and Europe. It's not like any of those, they knew that each other was doing it. They all individually started bloodletting. They did this to balance the quote-unquote humors. They believed the body was made up of 4 body fluids or humors.
We cover that in the plague, I think, don't we?
If someone was sick, it was because their humors weren't balanced. So they would realign the humors by removing some blood. It is still used to this day for certain conditions, but it is now called therapeutic phlebotomy. So it doesn't sound so archaic. They literally changed the name so it doesn't sound like a treatment 2,000 years ago.
Phlebotomy.
Yep.
Sounds lovely.
2 disorders bloodletting still treats is hemochromatosis, which is why my mother has to have it and I'll have to have it.
Which we discussed in our famine episode.
And polycythemia vera, which both present with an abundance of red blood cells that cause damage to the bodies. So they will... What are you doing? He's like...
I thought he was like, what is he? Is he pointing at a dollar bill on the floor, Laura?
Oh my God. So they literally put an IV in your arm and draw blood off your arm. It's not like before they used to cut your arm and just let you bleed out for a little bit. But that's bloodletting.
All right. Well, since you're talking about bloodletting, I'm going to follow that up with medical leech therapy, also known as MLT.
Oh, I didn't
Since maybe I have a few drinks on board, we're going to go with MLT.
Yes, please.
It's also called Hiriudotherapy. Hiriudotherapy also involves tapeworms at some point. Yep. And so I started, and the reason I know this is because I was looking into tapeworm therapy because that's what I was supposed to be covering, and I realized no, that's not actually what I'm covering.
I'm covering hookworm.
Yeah, no, when I get to milk baths.
Okay.
But apparently tapeworms are used for therapeutic reasons, but we're not talking about tapeworms. We're talking about leeches. And if you've listened to our very, very first episode, you'll know exactly how I feel about leeches. I think they're one of the most fucking disgusting things that the world has ever created.
It's made both of us scream and run.
They're disgusting. Yeah. They're like aliens. They're disgusting.
They're gross.
So the first record of leech therapy is in ancient Egypt.
Oh.
Those Egyptians, they were fucking in everything.
They were.
Chinese, Arabic, Anglo-Saxon, ancient Greece, and Romans have all used MLT, medical leech therapy.
Good job.
17th century Europe. It was its widest known use. It slowly decreased from there, but the last few decades, it's made a comeback. I'm bringing leeches back. Hey! All right. What is a leech? Well, they live in fresh water, and they're segmented.
I don't.
That word alone. Nope. They're hermaphrodites. Did you know that?
No.
They are, this made me want to puke in my mouth, carnivorous worms. Why is that gross? Because it means they eat meat. They are carnivorous.
Ew.
They're disgusting. They are sensitive to water, touch, light, heat, sound, and various chemicals, which if you listen to our first episode and Laura talks about they stick them in alcohol and they go, whoosh,
It's the weirdest thing I've ever seen. And fly backwards and just expel every drop of blood.
The funniest thing I've ever. They go
so
backwards.
weird.
I still laugh over that. Each segment has different organs, like ganglions and testicles. They have 2 sucker parts, and one works for creeping and one for adherence.
Ew, God.
The anterior sucker has 3 jaws with many teeth. So it's like,
Oh, my God.
It's like a fucking.
Now I'm gonna
what's the
scream
thing?
louder when
What's
I
the
see
thing
them.
from Stranger Things? Demogorgon. It's like all those fucking teeth coming at you.
God.
Okay. The bite warms parts of their host. It goes to the warm part of the host, and it sucks its blood in rhythmic contractions.
I would only want my blood to be sucked in a rhythmic contraction.
I don't want my blood sucked by anybody. I'm sorry. Maybe Eric Northman. A feeding takes about 40 minutes, and each leech can digest 10 to 15 milliliters, which is about 3 tablespoons of blood per feeding. And there are more than 600 leech species.
Ew.
600. And I'll bet you out there's some one big fucking huge leech out there. Like, that's the size of the Titanic.
Like, sucks onto your abdomen and you're
It's
gone.
disgusting.
Yeah.
Leech therapy is applying a leech for complementary and integrative treatments.
Yes.
A leech is attached to the problematic area, and the purpose is to gain potential utilities of leech saliva. Laura, what are those potential? Well, I'll tell you. We're going to get into it.
Okay.
When a leech attaches with its 3 jaws and many teeth to your fucking warm parts, it creates a pathway. Right in the fucking groins is your warm part.
That's the warmest part is the groins.
Under the sac. They secrete anticoagulants to keep the blood flowing in. They have antimicrobials to protect themselves from anything that they are sucking off the host.
Is it not amazing what these things have in? Like, isn't that like
It's disgusting.
mind-blowing?
They have analgesics so that you don't know
feel it.
you don't know where they are. Exactly. And they have anti-inflammatory effects. No, not attacks. Effects. All of these attributes of a leech's saliva make it perfect for a plastic reconstructive surgery, like finger replants, which we have told that story before.
Like an ear replant, which we've done on my
microsurgical replants. Like there was a story of a woman. She worked in she worked in some kind of factory, and her hair got caught in one of the machines and ripped her scalp off. And they reattached her scalp, and she was getting a dead patch at the temple, and they stuck leeches on it. Wunderbar! She lived. It's used for cardiovascular disease, DVTs, post-phlebitic syndrome, which is like phlebitis is when your feet swell and like areas swell because of lymphatic issues. Complications of diabetes, tinnitus. I don't know how leeches work for tinnitus.
I put them in your ear?
I don't know. Or near your ear? Like maybe around? Like how do you get a leech in your ear?
Wouldn't it like...
Laura's like fucking scratching her head.
Wouldn't it like go... No, you can't put it in someone's
You couldn't.
ear.
It would rip your eardrum off.
Yeah. No.
Imagine if like burrowed into your head, into your brain.
No, I don't understand that. I don't understand that.
And it reduces pain for osteoarthritis.
Really?
Those little fuckers are up to something. So now they are breeding them for medical purposes.
Yes, we have fun. We don't just get leeches. They're from a farm, a medical farm.
They come up in a bottle of
Ours
saline.
from New York.
And there's like 80 of them swimming around. Zoom, zoom, zoom. And they're like, you got to see these things.
Oh.
They fly around that
And
fucking
like
saline bottle. They're long and skinny and disgusting and everything you would picture.
And then you put it on, it curls up into this little
and it
ball.
becomes gigantic like a grape in about 10 seconds.
Yeah. And then you put it in that alcohol.
I don't want to be a host for anything.
No.
I don't want anything living off of me.
No.
Not even my kids. Love you guys. Yeah. So back to you.
Oh, I'm talking about, since we're talking about little buggers, maggot therapy.
Fuck. Yeah. The only thing I probably hate worse than leeches. Like,
I'd rather a leech than a maggot. I'm going to tell you that.
Maggots because they shimmy. You ever see them? Like you open
They
your trash
shake.
bin,
It's
they
like-
they shimmy.
like,
They like having little seizures. And there's like they're all shimmying in the back of the fucking trash can. They're disgusting.
Yep.
I hate them.
Okay, so if a patient has a chronic non-healing wound, there's dead tissue in that because it's constantly dying.
Yep.
So dead tissue leads to infections. If you have anything dead on you, we have to remove it because you're going to get infected and you will die of that infection. And you know what loves to eat dead tissue, Nicole?
Maggots.
Maggots.
That's all they like to eat.
Dead tissue.
They love dead meat.
They love it. Since patients with non-healing wounds need the dead tissue to be removed constantly, like if it's
a
wound's not
constant
healing,
debridement.
you come in and you get it debrided. And then you come back 3 days later and you get it debrided.
Unless you work with some of those weird nurses and they call it a debridement.
A debridement. No, I hate
debridement.
I hate those people. So you know what doctors can prescribe for you?
They
maggot
prescribe maggot therapy? I thought it was just like I was living on the streets and I didn't take care of myself.
No, that's a different thing. That's a different thing. Maggot therapy is actually therapy.
I've never
They
seen
have
it.
farms for maggots that they bring in and
Do you
medically.
need to farm it? Just let some flies in the room.
No, they don't do that. They're specific maggots.
That's gross.
They take sterile, farm-raised maggots and place them in the wound and let them get to work cleaning it out and eating all that dead tissue. And they
Work
don't
that
have
body.
to stop. You don't have to bring them back every 3 days because these maggots just eat.
And then you come in and there's like 800 flies in the room.
Oh my God. No.
Imagine. It's like Amityville Horror.
Yeah. This is different from, I don't even know how to say it, myiasis, which is a maggot infestation in a patient's wound that is discovered while removing tissue. So like if
I had a patient with myiasis and I almost vomited.
So if a patient comes in, they're like, oh, they got a really bad infection, they're gangrenous, we got to open it and take that tissue out. And sometimes you'll open it and there's just 1,000 maggots in the person's legs. That is not medical treatment. That is maggots infected their leg. But we can medically treat wounds with farm-raised maggots intentionally placed there and then removed. And that's maggot therapy.
That's nauseating.
Yeah.
I don't like maggots.
No, just take off whatever area has that wound, please.
Mm-hmm. Yeah. All right. Well, I have moved on. Medievalnews.today. Trepanation. Which is a fancy fucking word for burr holes. Trepanation, also known as trepanning or trephination. Yeah. It's the drilling of a hole in the skull, which we still do today.
All the time.
Comes from the Greek word trepanin, borer or auger or drill. Oh. No matter what year it was done or the process, the end result is always the same. You end up with a hole in the skull. Today, we do burr holes or craniotomies, but we replace the burr hole with a cover, little disc.
Titanium thing.
Or we put your skull back. In the past, the hole was left open.
Ew.
The oldest discovered skull with trepanation evidence dates back to 6,000 BC.
Yikes.
North Africa, probably Egypt, Ukraine, and Portugal.
Wow.
Both Hippocrates and Galen referred to trepanation.
Wow.
Between the years of 460 BC and up to 210 AD. During Hippocrates' time, there are records that trepanation was done for head injuries, so pus could ooze out and prevent madness.
Yeah, that'll make you mad.
If you're oozing pus out of your brain, you got bigger problems. Medieval times. Magic or religious reasons to free people from demons. They would do trepanation.
So you would do it to like psychiatric patients?
Yes. Yeah.
You would put a hole in their skull.
How else are you gonna get the demons out, Laura?
Obviously.
What the fuck?
Obviously.
They don't vomit out like the Exorcist. You have to put holes in the head.
Obviously.
Initiations to turn someone into a warrior.
A warrior? You put a hole in their skull to make them a warrior?
Isn't that what Jeffrey Dahmer was doing? Therapeutic reasons to treat tumors, convulsions, epilepsy, migraines, loss of consciousness, and behavioral changes. Or to treat the skull fracture.
Yes.
So there's evidence of people like picking, like in the Civil War and stuff, they would pick the bone skulls out and do a little burr hole. So throughout the 1700s and 1800s, trepanation was in and out of popularity. Though it was very popular during the Civil War. It has since given way to more sophisticated procedures of craniotomies, which we do every fucking day.
Literally.
Some people still believe trepanation is beneficial. So there are stories of people who thought, like, it's just put a hole in my skull because it's good for me.
What?
And yeah. And even John Lennon, they believe, may have either tried it, but he was trying to convince Paul McCartney to do this as well. Yeah. And Paul was like, you're out of your fucking mind. You and Oko.
I mean, there was nothing wrong with him, and he just wanted a hole in his skull.
He just wanted a hole in his skull.
I mean, if you have blood in your head and it's causing pressure on your brain, and we put that hole in and drain the blood, it is 100% therapeutic.
Yes, but to just do it for no reason.
But just to do it for no reason doesn't make any sense.
He wanted John Lennon wanted Paul McCartney to do it with him. Let Yoko do it with you. So I wish somebody would put a fucking hole in her head.
Weird people.
Anyway, so that
Don't say that. She doesn't mean that.
I didn't mean it with a bullet. It's just a burr hole. Just burr hole. Get the old. What was that craniotomy drill called? What did we call that?
Oh my
drill?
God, the
Hudson. The Hudson drill.
Yeah.
The Hudson drill. It was
Hudson
like
brace.
The Hudson drill was like an old-fashioned cartoon drill, and the handle went around, and I've actually seen them use that to get into a head, like during a trauma. They would.
We had it in that. You had it like
you
in
had
your
on
back
the bolt tray.
Yeah,
because that's what we call the ICP joints. We call them bolts. We put a bolt in. Yeah. So they were trepanning his head to put a bolt in.
Nice.
So on to you. That's trepanation.
Well, that's funny. They're on that because I'm on lobotomies.
Side note.
Yeah.
Last podcast on the left does a fucking amazing podcast on lobotomies.
Okay.
Check it out.
I can't.
It's so good.
I know. So this is the only therapy in this list that is no longer in use.
Lobotomies?
Yes.
Okay.
This way. I mean,
any way,
obviously
shape,
you do lobotomies for like a tumor
for injuries or something.
This is therapy is no longer in use, but was still performed up to 30 years ago.
Yeah.
This way. Dr. Aegis Moniz invented the lobotomy to cure patients of psychiatric disease. To perform a lobotomy, doctors would take an orbitoclast, which is like a long, thin nail, and place it next to the eye in the eye socket. Oh. So like right, like, you know, that little right here, right next to your nose, in your eye socket. And then the surgeon would take a mallet and hit that nail.
Holy shit.
Until it broke through the eye socket and broke the skull open. And they'd ram that right through the frontal lobe of your brain. Nail straight through your frontal lobe. Then disgusting. It would be repeated several times to, quote, interrupt the connections between the front of the brain and the main processing centers of the brain, end quote. It was a very successful procedure. Almost all the patients were cured of the psychosis. But they were also mostly left in a vegetative state.
Shit.
Luckily, antipsychotic meds were discovered, so we no longer do lobotomies for psychosis. And this is no longer done at all. Dr. Aris Moniz actually won a Nobel Prize in 1949 for developing this procedure.
Yeah, John F. Kennedy's sister had one of these done. And
yes. It leaves the people in a vegetative state. They
if
are no
you've
longer
ever
there.
watched, which is an excellent movie, One Flew Over the Cuckoo's Nest with Jack Nicholson, he ends up with the lobotomy, and he's just gonzo when he comes back.
You're not, if you put a nail through your frontal lobe, you are not right.
It's disgusting. Yep. It's disgusting. If you get the chance, listen to that podcast because it gets into how they were doing lobotomies for people with menopause, people with
because you were crazy.
Yep, unbelievable. And
he's gonna want me to have a lobotomy.
Like when they talk about, I've warned Brian already. When they talk about Rosemary Kennedy, they were like, she was reciting like the Our Father, and they hit one too many times. She stopped speaking and never spoke again. Yeah. Like, it was sad. It was very, very sad. And it was because she was just a little different. Yeah. You know? All right. So, we're going to go into shock treatment.
Okay.
Mayo.com, I got this. Shock treatment, also known as electroconvulsive therapy, which again is also seen in One Flew Over the Cuckoo's Nest.
ECT.
Excuse me. Today, ECTs are done under general anesthesia. Mm-hmm. Small electric currents are passed through the brain intentionally to trigger a brief seizure. Mm-hmm. This causes changes in the brain chemistry that quickly reverse certain mental health conditions. It's usually done when other treatments have failed. Mm-hmm. If you've seen ECTs in the past, they weren't done with anesthesia. They'd bring you in, they would put a gag in your mouth, fucking hold your arms and legs down and shock the shit out of you, and you'd convulse and everything else. These would lead to memory loss, fractured bones, and other serious side effects. It's used to treat severe depression, treatment-resistant depression, severe mania, catatonia, and agitation and aggression in people with dementia. Mm-hmm. Sometimes used during pregnancy because they can't use certain medications when they're pregnant. Older adults who can't tolerate drug side effects, or when it has been successful in the past. Risks of these ECT are confusion, memory loss, nausea, headache, jaw, or muscle pain.
Yeah, because that's...
Yes, because you're clenching. So when I was doing my clinicals at one of the Boston psych hospitals, there was a woman in there, and she had ECT treatment. And they tell you to ask these people. So I'm like, you think the ECT helped? She's like, absolutely. Before I had my ECT, all I could think about was killing myself. Mm-hmm. 24 hours a day, all I thought was killing myself. She said, since I've had these treatments, I don't feel like that anymore.
They say people rave, say it makes a huge, it's for severely depressed people.
Like you want to kill yourself 24 hours a day.
But they really say it makes a huge difference.
Given 2 to 3 times a week for 3 to 4 weeks. You give an anesthesia, blood. I forgot I wrote all this when I said that, so that's why I have to keep going. Blood pressure cuffs, monitor O2, and you have a mouth guard so you don't crack your teeth.
Because your jaw will be clenching.
Yep. Once you are asleep, a shock is given that lasts about 60 seconds. The seizure is induced, and you are monitored by an EEG so that they know, yes, they see a spike, a seizure is happening. A few minutes later, anesthesia wears off, and you are on your way. When I was also at the same psych hospital, I was allowed to go into the treatment room for ECTs, and one of the nurse anesthetists we worked with was in there. So they just bag them. They don't like intubate.
It's quick.
It's quick and calm. Like you wouldn't know anything was happening to these people when they were having it done. It was pretty impressive, I gotta say. So that is electro current therapy, also known as shock treatment.
All right. Next I'm doing, why do I do these names? Helminthic therapy, which is hookworm therapy. Up until 20 years ago, if someone traveled and came back with worms, it was like, oh my God, that's like grossest thing ever. Like the grossest of the gross. You can't, don't drink something there, you'll get worms. Don't eat something there, you'll get worms. Don't
use that toilet, you get worms.
You'll get worms. Everything was like, you'll get worms. Now,
you want those worms.
Yeah, we actually use hookworms to treat allergies and autoimmune disease with great success.
Allergies with hookworms?
Yeah. Yep. In most countries where people are naturally infested with hookworms, they have like no autoimmune disease and no allergies.
That's weird, huh?
It's bizarre.
So, like, talk to me. What does a hookworm look like? Do we know what these look like?
I don't. It's a worm.
Is it goes
in your
gut?
Yeah, it goes in your gut.
Okay.
So you would come home and people would be wicked sick because they had these hookworms, but it actually, I'll get into it. I don't know what they actually look like, but it's in your gut.
Okay.
They don't have, like, these countries that have these hookworm, people are naturally infested with them. They don't have Crohn's, ulcerative colitis, irritable bowel disease, no allergies. Like, it's unbelievable. They do not have these.
But you have a parasite living in you.
Yes, but you don't get sick.
It's quite a trade-off.
All you do. So we treat now they actually treat people with hookworms who have Crohn's.
Oh, I don't know about that.
Nicole, all you have to do is drink a glass of live parasitic worms.
Nope.
That then colonize you and start to knock out all your autoimmune diseases, all your allergies. These things, for whatever reason, I don't know why they do it. It works and it knocks out these diseases and allergies. So I have a ton of allergies. I will just stick with my allergies.
Yeah, Laura, I'm not going to come over if you have hookworm.
I'm not going to do the hookworm. If it was a tapeworm and could eat all my food, I might think about it. But
no, I'm not coming over
just to get rid of the allergies. I'm not doing it. However, it is a therapy for these diseases.
I don't like worms. I don't want pinworms.
Can you imagine? Like, can you see them in the glass? Do you think?
I'm thinking it's just the eggs, so they're microbiotic.
Like, if you didn't have to see them.
Oh, put a blindfold on. Imagine if you could taste it, like you could feel it like swimming in your mouth.
As long as you couldn't see or feel them. Maybe?
Nope. Mike, you want some hookworms?
If it would cure out, like if I had certain allergies, yeah.
I have allergies.
I would do it.
You'd live with
her?
For
my allergies?
You'd live with her if she took hookworm?
I mean, I don't know.
If you were allergic to red meat, would you have hookworms?
If she had hookworms and you're using her toilet,
and I'm going to the bathroom?
Hookworms.
Yeah, that's the other thing. Like, how do you
keep the rest of your family from getting hookworm? I don't know.
Yeah.
Any kind of worms, tapeworms, pinworms. If you're using anything that they pooped in,
yeah, you can get it.
I mean, if it means eating red meat.
If you had a red meat allergy like I do, I have anaphylaxis from red meat. You would take hookworms to try to get rid of that.
Yes.
His face dead serious. Absolutely.
Yes.
If it meant eating steak the rest of my life,
Steak,
absolutely.
Bacon, burgers, sausage.
You would have hookworms, so you could hopefully get rid of it.
Yeah.
Yeah.
I will not.
I would go vegan before I'd let worms.
Yeah, I will not be doing
that.
I'll just live with my allergies and maybe die from this. Fine.
Well, Laura, since we're talking about hookworms, I'm going to go with fecal transplants.
Ooh, nice.
Mm-hmm. My infantmation comes from Johns Hopkins, #1 hospital in the country.
Sometimes.
Well, depends on how much money we spend.
Oh,
also known as fecal transplantation, stool transplant, bacteriology, or intestinal microbia transplant.
I'm also telling you this now. If I have C. diff, I don't want anybody's poop in me.
You wouldn't take my cat crapsel?
No, I don't want any crapsel.
But I have good, healthy poop.
Nope. Okay, thank you.
Sometimes it's like peanut butter.
Nope.
Okay. Fecal transplant is used to treat persistent C. diff, a nosocomial infection, producing stinky, copious amounts of poop.
Yeah.
If you have C. diff, it can kill some people.
Oh.
When you're pooping, it's like you've had go lightly. It
It's
doesn't
lava
stop.
coming out of you. It's nonstop.
You cannot stop pooping. It is highly contagious.
And you get it from a hospital.
And you get it from a hospital.
Yeah.
A fecal transplant takes healthy bacteria from a healthy person and transfer it to a sick person. Usually done through a colonoscopy or done with an upper endoscopy.
Nope. No. I could almost go with you if you were putting it up my butt. You are not putting it down my throat.
I really hope you know this is a medical podcast with her putting it up her butt. But, well, Laura, if you don't want to do it up your butt or down your throat, you could eat a crapsule.
It's still down my throat. Your shit is still going down my throat.
Brian has missed his calling with the crapsule.
Mike has too.
Missed his call, $40 a poop.
This was a Thanksgiving topic a couple of years ago at my table.
Same. My son loves the topic of the crapsule. I'm dedicating this episode to him.
Well, I'm dedicating it to the Pouliots because they sat at my table one time and were floored that this was a thing and then couldn't stop asking questions about
because
it.
it's crazy.
Yeah.
Place in Medford, you can donate.
Medford, down the street from me.
$40 a poop.
Yeah.
So Drexel University, they are researching the crapsule. So you eat the crapsule, and the actual name of you don't eat the crapsule. The name of the article is Eat Crapsules. Researchers probe the power of poop. I loved the title of that article. Probe the power of poop. I mean, if we could harness the power of poop, my husband could retire.
Yeah.
All right. So the crapsule contains highly purified bacteria.
I hope so.
Spores from stool donations.
Spores from someone's shit.
It's gross enough when you do a sperm donation and you know that dirty old recliner that's in that room. Could you imagine the stool donations?
Do you bring it in? Do you poop there?
I'm assuming you poop on premises.
Because I guess you could take a sick person's poop and they wouldn't want that.
No, you got to poop on premises.
You have to prove that you're healthy.
Do you have to poop with somebody watching, like you do a drug test? Like, how does this go? I don't know. But
how do you just poop on demand?
And is $40 enough?
No,
for my shit.
No.
I mean, I am giving it to the sewer department for free.
That's fine. They can have it for free.
But
do they have a bidet? I need my bidet.
Well, it might overhydrate
I wonder
the
if they
fucking
have
sample.
A seat warmer.
Oh, to really
make it comfy.
I bet you they have a squatty potty.
Oh, you need a squatty potty if you're asking people to poop.
So you can get as much poop donations as possible. So once you donate your stool, the donations are then put into a pill form and administered to patients. What they have found, though, is in the early trials of C. diff, 50% of the C. diff cases came back. Oh. But they are not giving up on the power of the poop.
No, don't give up on poop.
They are back to the drawing board and hoping to use crapsules to help patients with Crohn's and colitis.
Why? Why do they need poop? Why do they need my poop?
Because something about the healthy, like the hookworms,
to line the
it does. They're missing something. Because in that poop is all kinds of flora. C. diff and other illnesses get rid of all of that, which is why you shit your brains out. Yep. No.
I can't give my poop to a diabetic, I can tell you that.
No, oh my God.
You couldn't
give it to me. I'd go into diabetes. Yeah. So that is the power of the poop, Laura.
Oh my God. No.
Power.
I'll take my chances.
The power of the poop.
Take my chances with C. diff. Okay, this one might make me gag while I'm talking about it because it was making
Let me swallow. Okay.
Because it was making me gag when I was writing it down.
Yeah.
Again, I'm not going to be able to say this. Oh God. Osteoodonto keratoprosthesis. That's what I'm talking about.
Osteo's bone. That's all I got.
Odento.
Dentist, mouth. Okay. Bone, mouth. Kerato is that hair or skin?
Prosthesis. Mucous membrane. It's a tooth in your eye.
In your eye?
Yep.
Why would you put a tooth in your eye?
This was developed in the U.S. And performed for the first time just a couple of years ago, Nicole. It's used as a last resort surgery for people with diseased corneas. When your cornea becomes cloudy and damaged, the eye can no longer see through it and people go blind. So they have a million other procedures to do to try to fix your cornea. You can do a corneal transplant, blah, 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 blah. You can do a million things to try to fix this. It's bad when your corneas go bad. if nothing else works, we can do a tooth in your eye.
I'm
This
getting
is the
sick thinking
procedure.
of it.
Oh, God.
Like, do you walk around with an actual tooth in your fucking eye?
Scarred area of the eye and the eyelid are removed. So your eyelid and your
eyelid?
and the scarred part of your eye are all removed.
Is this done in the United States?
That's how we developed it. And then you replace that you just took out with the lining of your mouth. So they take out some lining of your mouth and put that into your eye socket. And then they remove a tooth from your mouth. Then they drill a small hole in your tooth and place a small lens inside that hole.
A lens.
And then they take that tooth with a lens and stick it in your cheek and wait for it to get vascular. Like, wait for it to get a blood supply. Okay? So now you have your tooth with your lens drilled into it in your cheek. In your eye socket, it has your mouth lining in it.
Is your eyeball still in it?
No. Well, they removed the disease part. So I don't know, like, I think part of your eyeball, you know, like, they didn't really
Is this to make you see again? There has to be some eye
this
left.
is to make you see.
You'd have to have a retina and an optic nerve left.
Because it goes to the back of your eye. So I don't really know
what's going on.
Just the cornea they remove. I don't know. So you get your tooth implanted into your cheek. Once the tooth has blood supply, it is removed from the cheek, and a hole is made in the mouth mucosa that's covering your eye, and the tooth with a lens is placed in that hole.
Who thought of this?
I don't know. The mucosal layer has a hole where the pupil used to be, so it's just a hole to the back of your eye. And the tooth with the lens allows the light to be reflected to the back of the eye, allowing the patient to see again. So you are walking around with your eye with mouth mucosa and a tooth with a lens in it.
How am I supposed to talk to you with that?
I don't know.
How am I supposed to look you in the face?
I don't know.
Not say anything.
I don't know.
And not crack a smile when you're looking at me through a tooth.
I just don't know how that can become, like, is it worth, like, the uncomfortableness? You know, like, that can't be comfortable.
I mean, I don't know. Seeing is pretty big.
It is. It looks like there's a tooth sticking out of your eye.
Do you have a picture?
I will put it up on social media.
Please.
It looks like your eye is red and it has a tooth out of it.
Why a tooth?
It looks like
we
there's
couldn't come up with something better than tooth.
It looks like you have a tooth in your eye.
That's disgusting.
It's horrible. I don't know how many they've done. They just started doing it a couple of years ago.
Why?
So people
you can't come up with a better form to look out of than my tooth?
I don't know. And then that whole time that tooth is in there getting the blood supply, this is just covered with your mouth mucosa.
Well, you're going to have one of those pirate patches on there.
God willing. Maybe that's what they do, and then when they have to see, they flip it up.
I get the mouth mucosa because your eyelid. I get that. I don't get the tooth.
It doesn't look right.
I don't get the tooth.
It doesn't look right. It looks like there's a tooth sticking out of your eye.
That's disgusting.
It's bad.
I don't even know what to say to this.
Yeah, it's bad.
Well,
I'll put pictures up.
That makes my urine therapy look pretty pathetic.
It does.
But my milk bath. Wait till I get my milk bath. All right. Well, that's a hard act to follow, Laura.
Sorry.
I'm going to go with urine therapy from WebMD.
I mean, that doesn't sound great.
Well, in the past, it has been used as folk remedies, human urine, for asthma, arthritis, allergies, cancer, indigestion, migraines, and infertility.
And jellyfish stings.
In jellyfish strings. But as we know in jellyfish
doesn't work.
Strings, human urine, even in survival mode, is considered unhealthy and dangerous. Urine, especially in the dehydrated form, which is when you would be drinking it, contains a high amount of salt. So drinking it will make you even more thirsty and unhealthy. So do you know what we use instead of human urine, Laura?
Animal urine?
What kind?
Horse?
Yes.
Oh my God, I'm so sorry.
We use...
Because you pee like a racehorse. That's why I thought of that.
Yeah. We use horse urine. Pregnant mare urine is used in many female
Pregnant mare urine. Okay.
It is found in Premarin, Estroderm.
Really?
Vaginal creams. Vagifen.
Oh.
And it is a very contradictory, with like human PETA and all those places don't like it because the female horses are kept pregnant to create this urine.
I was going to say that's not
to
that.
make
I mean,
the
they have
drug.
to pee, but okay.
Right, but they're kept pregnant,
Yeah.
And so the humane groups are really bullshit about it. So there's not a lot of fact on it because every article gets either humane therapy or whatever. So, but that's what it's used for. We use urine.
We're using horse urine for our vaginas.
For vaginas, yeah. For vaginas. All right, what you got?
Okay, I got an honorable mention on ichthyotherapy.
This is not going to be good.
Fish therapy. It's fish therapy.
Yeah, what does it do, though?
It's not as bad as
you
think.
Eating them?
No.
Are you shitting them?
No.
Are you letting them swim in your mouth?
No. Gara rufa, which is nicknamed the doctor fish, live in the rivers in Turkey and Iran.
Do they have little stethoscopes around their neck?
Yes. And little white coats.
And then they're really condescending to all the other fish. Pardon, I'm a doctor fish.
For hundreds of years, people with skin ailments on their feet have gone to these rivers and had the doctor fish pick away at their skin.
Oh, the Kardashians did shit like this,
to
didn't
remove
they?
the ailments, yeah. So now, these fish, that's what they do. They literally, if you put your foot in there and you had psoriasis or you had some like infection or whatever, they would, if you put your feet in these rivers, these fish fly to your feet and bite off. You don't feel it because it doesn't. They're little teeny tiny fish. Bite off any of that affected tissue, so it helps cure whatever ailment you have going on.
That would disturb me greatly.
Yeah. So now they can be used to treat psoriasis and dermatitis of the feet, or just remove your dead skin in a pedicure because they'll put these little fish in a little pool at your pedicure place.
I still would rather the cheese grater.
Yeah, I like the cheese grater. Makes me feel good.
Good.
But they do this, like you can go get a pedicure with these fish and you put your feet in the water and they swim up
that's
and bite all the dead skin off.
That's disturbing. I don't want them eating my feet.
And that's fish therapy.
All right, well, Laura, my honorable mention made me gag. And like I said, I started investigating tapeworm therapy because I thought that's what this was about. So due to the size of a tapeworm, their teeth are very intense.
Why do these things have teeth?
Because they got to latch on to the intestinal wall.
Oh.
So they're very difficult to get rid of. So like modern day treatments, you eat something that makes them just sick and then you shit them out. They detach and you shit them out. But in the past, people try a milk bath.
No, I'm afraid of this.
Most clinicians say this doesn't work, but this does not stop people from doing it. What is a milk bath? Well, the theory is that tapeworms love milk.
I do remember that. And sugar.
Yep. So if you put your ass in milk, the tapeworms will come out of your ass. Or, this is my favorite.
Not an enema.
Sleep with your mouth open next to a glass of milk.
Why would you just put your ass in milk?
Could you imagine waking up and a tapeworm slithering out of your mouth?
No, why would you do that? Just have it come out of your ass. Why would you want to come out of your face?
And there's a picture of a fucking basin of tapeworms that goes with this. Like 100 fucking tapeworms. Why? I literally was at work writing this and I was like, ugh! And they're like, what? I'm like, oh my God.
Why would you want them to come out of your face?
But could you imagine waving your ass over a thing of
I
milk?
would rather wave my ass over milk than have it come out of my mouth to a glass of milk.
Sleep with it next to your mouth, Laura, and they'll all come out.
You want something that's been in your intestines, in your stomach, to come out of your mouth.
Now come out your esophagus in your mouth.
That's what I'm saying.
Your face.
You want it to come out of your face.
No, I don't.
I would rather it come out of my ass.
I don't want them at all.
I don't either, but it's coming out of my ass.
When I was a kid, my mother used to tell me if I ran around barefoot, I'd get tapeworms.
My mother used to tell me. No, someone used to tell me. Was it my mother? I don't remember. You must have a tapeworm. You eat like a truck driver.
But my mother, if you run around, you bite your nails, you're going to get tapeworms.
Oh, you'll get worms. If you bite your nails, you get worms.
You're going to get worms.
Yeah.
It's a given. You get worms from that. So I found that fucking disgustingly revolting.
Why?
Could you, I would rather wave my ass over a glass of milk.
God.
But could you imagine, like,
milk all day.
all of these worms coming out of your ass while you're just waving it? Nope. So milk bath. That was my honorable mention.
I'm going to throw up.
And with that,
I'm
done.
I have one more.
Okay. I am done.
Which I thought was gross until you talked about those coming out of your mouth to a glass of milk.
Nauseating.
This honorable mention was Hippo Sweat Sunscreen. Research into sunscreens has found Hippo Sweat to block nearly 100% of UV rays.
And how are we obtaining this?
It does not damage human skin and does not harm animals in its processing because hippos just sweat out the sweat. Sounds great, right? Like, no
Imagine
problem.
how much that sunscreen is.
No, you're not going to wear the sunscreen, Nicole, because hippo sweat is not clear and salty like human sweat. Hippo sweat is called blood sweat, which is neither blood nor sweat, but it's something that they secrete naturally for sunscreen for themselves. It looks like they are bleeding out of their pores. And people want to use this
Nope.
The blood. It's not blood. I don't know what it is. It's not blood or sweat. It's like gross. It's a natural sunscreen that they excrete, and it looks like.
All right, so hippos spend the entire time of their life in water. Why do they need fucking sunscreen?
Well, because their backs are out. You know, your back. If you're swimming in the pool, you got a sunscreen on. So they literally secrete this red shit, and it's been studied, and we can use it as sunscreen.
Fucking Kim Kardashian's probably paying $1 million a bottle for that
her
shit.
Her skin looks great. Yeah. We got this list from shortwhitecoats.com.
It was that was something.
That was gross. Oh, so we have that email.
Yeah, so we do.
Okay. This is an email called Jet Ski Ouch. Mm-hmm. Hi, ladies from Georgia.
Hi.
I love your podcast, and I've been listening almost nonstop for the past few months. I just finished listening to your episode recapping summer episodes, and I realized I had a small story. She said that jet skis, they seem fun and they seem like a great time. And I love riding a jet ski. But there's a reason it's called a jet ski is because there's a jet of water shooting from the back of it. If you fall off, which people do all the time, fall off the back of the jet ski, there has been cases that the jet stream of water shoots directly up your butt, because if you think about when you fall off, you have your legs around it. When you fall off, your legs go up. Your butt is facing.
Talk about a bidet. Holy shit.
Your butt is facing that jet of water that is screaming out of this machine. And it has torn patients' rectums.
Yeah.
If you have your rectum torn, you have to have surgery. They have to give you an ostomy because your rectum is torn up. To divert, to let everything rest. Usually it's temporary for that, but it could be a permanent ostomy. So you really need to think about it before you get on to a jet ski, because that is a jet stream. Anyways, I hope you guys are doing well, and can't wait for your next episodes. Katie.
Katie, email has been paraphrased to protect the innocent. So if you're wondering what we just did to your email, we're just making sure that there's no identifiable marks to anybody who may not want to be known.
Yes. But
thank you for the email, because that's quite, I never thought of that.
If you think about how you fall, like I've fallen off a jet, like if you fall, think about how you fall back, your ass is facing the jet ski.
Oof, that would fucking kill.
That is a huge stream. It's a jet stream of water.
That would absolutely kill.
It will literally rip up your rectum. So be very careful on jet skis, people.
And there you go. So welcome to October. Yeah. Here we are. October is also, is it colonoscopy month, colon cancer month? So our next episode, we're going to cover colon cancer, colonoscopies, etc.
Yeah.
All the things we can put up your butt.
Yeah.
That are legal. So have a wonderful day. Enjoy the fall, pumpkin spice, and we'll talk to you later.
Bye.
Like, subscribe, rate, and review the Scissors and Scrubs podcast on whatever podcast app you listen to us on. Follow us on Twitter, Facebook, and Instagram at Scissors and Scrubs. And email us any of your stories or thoughts to scissorsandscrubs@gmail.com.